Well, now I would like to invite Dr. Pawan Gupta, Director, Surgical Oncology, MAX Institute of Cancer Care. Dr. Gupta is a well-known oncosurgeon based in New Delhi. He is the Director, Surgical Oncology, MAX Institute of Cancer Care, East Zone, and the founder director of ICanCaRe, an innovative enterprise for cancer care and rehabilitation, and tobacco cessation intervention. He is also the national convener and master trainer Tobacco Cessation course accredited by Gujarat University and the national president of the ICanWin Foundation. Dr. Gupta will be speaking on the topic harm reduction or complete cessation. So over to you.
Thank you, Lottie, and thanks Anil and Sajana and Rajesh. Uh, Actually, I come from the background that I'm an oncosurgeon, and I have been seeing patients of all types, whether it is smoking or smokeless varieties. What I want to just add here is that by what we had seen, like in 80s and all, we had seen more of smoking varieties, which was very well written. It is injurious to health. We are seeing more of lung cancers and esophageal cancers and the stuff. But addition of non-smoking varieties had actually increased our more number of diseases. Right now we have got more of oral cancer, and we are the world leader in oral cancer. And probably a lot of doctors now come to see us how we treat our oral cancer patients. Earlier we used to go to the Western world and just check. But now we are the masters. We are training them oral cancers. By adding another variety, that is the e-cigarettes, and we are probably increasing more number of diseases to our already, which is already existing. I come with that clear thought, and that is that या तो आप कुएं में हैं या कुएं के बाहर हैं. Either you are taking tobacco, you are not taking tobacco, whatever the varieties. But at the same time, I'm also looking at what Dr. Desai says. We need to have system set for tobacco cessation. That is how to help a person quit tobacco. That is the system set. Yes, that may require NRT. NRT is also a form of harm reduction. That may require NRT. Yes, we need to give NRT to our patients to help him to completely quit tobacco. That is the goal that we need to have. It's not that कि चल भैया चलता रहेगा, चूर लेता रहे, फिर छोड़ दिया तो चल फिर सिगरेट ले ले, फिर चल तंबाकू ले ले. Our goal is very clear that we have to use NRT for the purpose, with the goal that this person is going to quit tobacco over a period of time, maybe 3 months, maybe 6 months, or whatever. We have to fix our goal. Yes, this is the. So here what I say, we need to have NRTs. NRTs doesn't mean only particular varieties that is being means put to the youngsters, which is being impact messaging is being done for these varieties, which is making these youngsters feel that oh, they are if they do not take that, or if they are not having that, then they are not in the peer groups. No? So we should not be advertising that, or we should not be putting it forth. And all the people who are actually advertising such things are actually putting patients or putting people to take suicide, right? So they are, in one way, they are putting people into risk, and they are actually, these children will ultimately die because of tobacco. I put it in very clear way. I have made a simple balloon in our system that what I say, there are 5,500 people entering into that balloon every day. That means 20 lakhs per year. 3,700 people existing this balloon every day. That is 13.5 lakhs per year. And how they are existing? How do they exit this group? By dying. And painful death, either by cardiac, respiratory, stroke, or cancer, or 200 diseases which have been defined, whatever sir is saying, impotency, whatever, they are suffering in their life. So we have to work together into that factor that yes, we can bring that change, and that is where we have to work. And that is where I come with my experience. And let me put it, my journey as an oncosurgeon started in tobacco cessation because of one sentence that was told by me by one of my patients. डॉक्टर साहब आप तंबाकू छोड़ने के लिए बोलते हैं, कैसे छोड़ें ये तो बताते नहीं. And this is the problem with all the clinical people who are sitting here or who are not sitting here. But the problem is we are doing quackery of tobacco cessation. We are actually not entering, we are not actually doing dedicatedly, we are not doing tobacco cessation. If we do work dedicatedly, we are busy clinicians. A cardiologist who is a busy clinician, she can't put her time for tobacco cessation because it needs dedication. I'm an oncosurgeon. I don't have too much of time to put it. So what I did, so I started a Tobacco Cessation Center at Max Hospital, which is a dedicated center. We have trained people, and it's not a psychiatrist there. We have a dental surgeon who are working there. We have trained them, who are dedicatedly working for tobacco cessation, and we are getting results. We are getting patients being referred from all the departments, whether it is cardiology, pulmonology, gynecology, orthopedics, ophthalmology. Every department is referring patients to that center, who is dedicatedly working, and we are showing results. The results are there, and that is what we are working on, and means the results are very high. And let me put it, my patients who come with cancers, if I say them that please quit tobacco, they will quit tobacco. If I don't say, अच्छा ठीक है तंबाकू छोड़ देना, without emphasis, चलता है, he's not. But with emphasis, with work, it will work. So we have started, I'll just in short, we have started a Save the Youth program. Save the Youth program, that is our campaign. Save the Youth consists of SAVE. S is for sensitization, A is for assistance, B is for volunteer training, and E is for enforcement. So S consists of three things. Be smart, do not start. We have a book for that. Be smart, do not start. जागरूक रहें, प्रारंभ न करें, and we have distributed 1,65,000 book before COVID, and we have been now doing it digitally across India. And we are going to the schools, colleges, and it is a dedicated program where we are training volunteers to go and do it. It's just not possible for me. I have myself done 647 schools. Then the second part is win over tobacco is easy. That is what we want to put it to the people. If we do tobacco cessation dedicatedly and properly, yes, it is possible to quit tobacco. And those who are saying that it is not possible to quit tobacco, let them redo it. That is, yes, it is possible, and we have to work on it. It may take 5 times, 6 times, yes. And probably by the time that person has come to me, he has already had 5 times or 6 times. So when we work with them, it becomes very easy for us to work, and they do quit tobacco. Third is be careful and fearful. This is another work that we are spreading out amongst the people who are not taking tobacco, who are not smoking, who are not taking e-cigarettes, who are not taking anything. Be careful and fearful with the people who are taking tobacco around you. Do not be with friends with them. Avoid them. People will say that we should have empathy towards them. Arey bichare le rahe hain, bichare phas gaye. Bloody hell, if they have taken, bhai, you are not included in my society. Get out of it. Right? That is where we have to work. We have to create that feeling in every youngsters that my friend cannot be a tobacco user. If he is a tobacco user, he is not my friend. That's it. The second is that we are working on assistance program, assisting to help people quit tobacco. We have done extensive research on that. We have even made various groups of the patients who are high metabolism, low metabolism, or neutral metabolism, and how to intervene for each of the patients with NRT, with platinum models, with NRT, without NRT, with varenicline. Varenicline, no one is talking about varenicline, which is available in India, and it is a wonderful drug for our patients to quit tobacco. We can help them. A lot of our patients are on varenicline. So we have dedicatedly, we have started an app, a software which is protocol based, how to help a person to quit tobacco. We have started a national quit line number, which is the first private quit line number in India. We have started that, and we are getting calls across India, and we have started a virtual tobacco cessation program where we are getting patients across India to help them to quit tobacco. This is the V is the another thing. I'll just take 1 minute more. V is another important thing, that is the volunteer training. What we started is we got with Gujarat University, we started tobacco cessation certificate programs, how to train doctors. We are training doctors to help quit tobacco. We made it in 2 steps. That is, one is the specialist who will do the tobacco cessation. The second is the orientation, that is like clinicians like us who do not have the time to actually go in deep into, but we need to understand tobacco cessation. हम लोग खाली superficially बोल देने जाते, छूटता नहीं है, चल तू चला जा. That will not work. We have to be part of it. We have to work. All the clinicians have the moral duty to work for this, all the patients, because all of us sitting here will come across tobacco patients who are come with tobacco, right? So we did it in 2 steps. That is the orientation, Certified Tobacco Cessation Specialist course, and the second is the orientation course in tobacco cessation. And this is all Gujarat University certified courses. We had worked extensively in that to make it a very protocol-based training program. Third is basically enforcement. Like in university, if you want to enforce, Dr. Sahab can't, Sunil can't go every day and do it. We can't have. So we created tobacco marshals. Like I'm putting a tobacco marshal batches. I have got a cap of tobacco marshal. We started a tobacco marshal program where we started training the teachers, the students. In a PSU, we started training the HR to become tobacco marshals within the group. And specifically, we are actually targeting the women as tobacco marshals. Because of whatever Madam has said, we have already noted that tobacco marshals are influencers in the society who work closely because they are within that place, within that university, within the school, within that thing. So that any person who is taking tobacco will be immediately taken care, and if needed, they can be sent to the tobacco cessation centers to be trained. So just 30 seconds.
We'll have to wind up.
30 seconds.
Okay.
So what we are actually doing, we are into the training. Now, after the successful tobacco cessation center at MAX, we are looking at setting up such centers across into various other hospitals so that this can successfully work and successfully we can work it out. Last year we trained 705 doctors. This year we are training 220 doctors. We have a target and we have been funded for that. So thank you so much. I will not take it further.
Thank you so much, Dr. Pawan.